violence against medics in times of conflict and political unrest happens time and time again. Think about the attack on the Doctors Without Borders hospital in Kunduz, Afghanistan. Think about attacks on polio workers in Pakistan. Think about the fact that in the past 5 years, approximately 700 medical staff have been killed in Syria alone. Medicine matters, in times of war even more than normally. And destroying a country's healthcare system is one of the most effective ways of hurting a civilian population and hurting injured combatants. When you kill a medic, you kill much more than that one person. You kill every single person this medic could have been helping, both now at the moment as well as in the future. And if there's one thing you need at a time of conflict, it's somebody who can help you. Because when you are in a conflict, the chance that you will die because of an illness like pneumonia or diabetes, something that would in any other circumstance be perfectly treatable, is actually much, much larger than the chance that you will die because of a bullet wound or something, or because of another consequence of direct combat activity. You simply can't get even the smallest amount of medical assistance at times. But it's not just during a conflict that you as a civilian have a really, really tough time. Long after the ink has dried on a ceasefire, the healthcare system still needs to recover. It will take generations to rebuild a stock of medical staff who can help you. And moreover, it's not just the people in an area of conflict itself who suffer. Because illnesses, diseases, pandemics, they don't care about battle lines. And they don't care about who is right or who is wrong. They will travel more freely than people. So for all these reasons, we have strongly prohibited it in international law to damage each other's healthcare systems. Whether you're a state who is fighting an uprising, whether you're a force of combatants who are fighting others, we need to protect those health workers if we need to protect the civilian population in that country as well as ourselves. And because of that, I try to study and find out why and how people attack health workers. This is not a very easy question to answer. We just simply do not know how to go about it at the moment. You have the very general issues of trying to find a piece of truth in a conflict situation. And I was brutally reminded only last week how incredibly, incredibly dangerous it can be to look for some truth when you're in a dictatorship or when you are studying a conflict. But there are bigger problems with the quest of why violence happens against health workers. One of them, for instance, is the fact that we are not really focusing on the right people and we may not be asking the right questions. So when we talk about violence against health workers, we often still focus on people who work for international organizations. We look at people who work for the Red Cross, or we look at people who work for Doctors Without Borders. But often, these international organizations are not the most important ones for the local population, because they cannot get to the most dangerous areas in a conflict. The people who are there, who are helping those local people, are actually people who just were trained to be medics and happen to be living there. They weren't people who chose to be and go into a conflict. There were people who were just doing their normal jobs in their regular villages, and all of a sudden they find themselves in a conflict. And all of a sudden their work matters even more than it normally does. But it's really, really difficult to get to those people. They're hard to reach and even harder to research. But still, they are the people who face most attacks. And they are the last ones standing, and we should be looking at them. And another thing that we do is that we have particular assumptions about the way we go about this. What we do mostly is we count attacks. In the summer of 2015, so many people were killed. And in the beginning, I thought that this made sense, right? If I have numbers, then the only thing I need to do is I need to look at what factors change, and I can maybe do some kind of like statistical analysis, and policymakers like this, and researchers like this. But I pretty soon found out that numbers say very, very little when it comes to violence sometimes. And another thing that we think about is when we talk about why these people are facing attacks, why medics face attacks, we often have particular assumptions. we say, for instance, well, maybe the people who are attacking them, maybe they don't know that what they're doing is illegal. Or maybe the people who are attacking them, maybe they do know it's illegal, but they simply don't care. Or maybe they think that the medics have done something that somehow releases these combatants of the need to protect them. I think we're asking the wrong questions sometimes. The way we're now doing it, the way we're now approaching violence against medics leaves a lot of questions unanswered. For example, it can't tell us why particular armed forces decide to attack a hospital at one moment, but not at many, many other occasions that they had to do so. They can't tell us about a situation in which there are so few medics left and so few hospitals left that there's simply nobody left to attack. How is this reflected in the numbers? How are threats reflected in the numbers? How can you attack something that never was allowed to take place in the first occasion? So for all these reasons, I thought that we needed to think about this in a bit more clever way than we're doing at the moment. I started trying something out. So one of the things that I'm doing is I'm looking at this problem as a strategic issue. So I think that there's a connection between attacks on health workers and the kind of conflict in which a health worker works. If you look at it like this, it is one of the few ways in which you could possibly explain why attacks take place at some moments, but not at others. I started to look at one particular conflict, or better said, one particular moment of civilian unrest and uprising in a country that I happen to know quite well, and this country is Egypt. When I studied Arabic as a young student, I lived in Egypt for a while. And once I started having this idea about researching medics in their context, I realized that the Egyptian uprising had a lot of medics who were active in it. Egypt just experienced a revolution against President Hosni Mubarak and many, many protests afterwards against the Supreme Council of the Armed Forces that followed him, and later Muslim Brotherhood President Mohammed Morsi. During these protests, protesters would often get hurt. They would be shot at, they would be tear gassed, sometimes they would experience live fire. And they would go to the hospitals. But at the hospitals, they would often face arrest. Because what is more pragmatic than, if you want to arrest protesters, than to go to the hospitals, roam the corridors, and simply look who looks like they might have been in a particular protest? It's a foolproof way. And because of this risk, you had to start of a whole medical infrastructure around Tahrir Square, where doctors in little medical points and field hospitals started treating injured protesters with the goal of returning them to the front line so they could continue protesting. And just to give you an idea, in a week or so, at the height of the uprising, they would treat thousands of people. So we're not talking about a small initiative. We're talking about thousands of lives being saved. I wanted to connect these attacks that they faced, because they regularly faced attacks, to the conflict. And I do that by an approach in which I combine 3 bodies of knowledge. So what I do first is I look very detailed at the context of the conflict. So I look not just at, oh, what kind of thing is it exactly? I look what happened exactly on this specific day in that particular occasion. Was there a particularly tight balance of power? Was there something extraordinary happening? Secondly, I look at the capabilities of the medical professionals there. So I was looking at how advanced they were. How much were they able to do? How much were they able to accomplish? Were they able to accomplish so much that they might actually be able to shift the balance of power at that moment in the street? And thirdly, what I do is I then look at the pattern of attacks. The way that I go about this, that I try to connect patterns of attacks to the actual conflict context and try to come up with ideas of when these doctors are at their most vulnerable, is that I went into the field and I conducted tens of interviews with dozens of health workers and non-medical volunteers in this emergency healthcare system. And I asked them about everything. What made them decide to risk their lives for these protesters, even for protesters they did not personally agree with? And these were tough conversations to have. These are not people who have had a very, very easy year, and oftentimes they were very young. They were our age. And their stories were one of hope. They were one of humanity at a moment where humanity is not easy to find. But there were also stories of self-doubt, of uncertainty, of wondering whether they had done the right thing. The fact that 5 years after the revolution, many of them are still lying awake at night, thinking about how they may have wronged a particular patient or may have made a mistake, that says a lot. I found the following outcomes. Firstly, I found out that indeed numbers didn't matter very much. And the way that I found it out was very easy, because when I talked to the doctors, it turned out that the moments in which they reported being most stressed and being most terrified were actually moments in which there weren't a lot of attacks. Because what would usually happen is that they would set up a medical point or a field hospital, and those field hospitals would be raided once in a few days. And soldiers would be barging in, or thugs would be barging in and cause a lot of havoc, and then they would leave again. But at a certain point, after they had proven how incredibly effective their medical services were and how good they were in returning people again to continue to protest, you see a kind of preemptive strikes on the part of the government. And you see them calling up people personally and saying, if you allow a field hospital to be established, we will burn it to the ground. We will arrest everybody. We will destroy that thing. So you see people not being able to set up field hospitals in the first place. And that's one of the things that you don't see reflected in the numbers. But what I also saw is that there was definitely a pattern in attacks. I saw the number of attacks actually rise after they had proven how incredibly effective they were. But I also saw that it was very politicized. I saw that, for instance, at the moment where the security forces weren't happy with Mohamed Morsi, all of a sudden the number of security force attacks on medical points in protest against Morsi start to diminish slowly and surely. What I also saw is that these doctors were anything but passive actors. They were able to stand their ground, and that is something that, again, you never see reflected in the kind of research that we are conducting. So they had a very sophisticated system of protecting themselves. They would rely on street youth, they would rely on football fans, and they would rely on the revolutionary youth movement to immediately give them some kind of relief at the moment of attack. But next to that, they had a whole bunch of high-level political figures that they would call up whenever they found themselves besieged, and they would pull strings, and they would bluff their way time and time again out of situations. How can I see that in the numbers? What I also noticed is that attacks took many, many more shapes than you would have thought. It wasn't just an attack on an ambulance. It wasn't just a raid on a hospital. There was a whole media war going on against these individuals in which they were accused of theft, accused of sexual harassment, and of all kinds of other things that would delegitimize them. So the point that I've been trying to make in this talk is to show you how incredibly important violence against health workers can be, and what an incredibly huge problem it is for everybody. And that we need to start looking at this as a problem within a context, and that we need to start looking at this as a problem that goes beyond the simple numbers. And if that is the one message that you take away today, this has been a very effective 15 minutes. Thank you.